Happy New Year.
Happy New
That
Year.
was wonderful.
Thank you.
That was
That was
wonderful.
awesome.
Funny. And true.
And next we have health and welfare. Are there any updates on the health and safety of Rotarians? Good. Everybody must be.
President Ray, you may have saw that Christina Church gave birth to her 2 baby girls a couple of days ago.
Wow. Fantastic.
And then I saw on Facebook that Jonathan Hahn, a former board member's mother, passed away this week.
Oh,
All right.
so that's the bad news.
Yeah.
Okay, anything more? All right, next slide. Are there guests to be recognized today? Okay, seeing none.
Oh, before we do this,
For the
can
program, right, go ahead.
we run Michael's video here? So I'm going to see if I can make this all work.
Okay.
Please be patient with the director here.
I say that all the time.
Can you see that screen?
Yes,
Sure
push start.
can.
Yes.
There we go. Nice.
Well, guess what? Thank you for playing that. I'm doing a new show, and I'm doing it for the Capitol Theater. I think that's pretty obvious, and the Whiting and down. I even have my official Capitol sweatshirt on here
Okay.
at home. I got it for Christmas from my daughter. Let me tell you a little bit about what the show is. The show is called Capitol Memories, and what we're going to do is focus on the Capitol in downtown Flint to talk about entertainment, the Capitol building itself, the restoration, the amazing restoration of that beautiful building that's almost 100 years old. It's been at the center of Flint for the past century, and we kind of want to play on that with at the Capitol Theater and the Whiting. I'm working with Anne Marie Van Dyne and their staff over there to pull this all together. And I've been finding out all kinds of fascinating facts about the Capitol. I'll give you a couple quick examples to tell you an idea of what the show is going to be about. We're going to, one of the things is it was built in 1928. Also built in 1928, which kind of surprised me, Flint Northern High School, the IMA Auditorium, the Barrage Hotel. And that's just the beginning of the list. It was a boomtown in 28. And we're going to talk a little bit about that. We're also going to talk about individual people's memories of the Capitol Theater. And I've mentioned earlier, my Capitol memory, my first one was going to the Capitol when my mom took my brothers and sisters, and there were 5 of us, 64, to go to see a movie at a theater for the first time in my life. It was Mary Poppins. And I remember walking in there and looking up, and I said, Mom, there are stars up there. And if anybody's been to the Capitol Theater, they'll know there are stars in the ceiling up there. I remember saying that to my mom. And of course, my mom grew up in Flint and knew about that too. I'm looking for your Capitol memories. And on Tuesday, next Tuesday, from 1 to 4 at the Capitol Theater, I'm going to be collecting them. I need about 10 minutes. If you've got a story you want to share, and I'd love to have you share it, send me a quick message. I'll get my email up here on the chat so you can see that. And we'll set a specific time. It'll take about 10 minutes in and out. We'll make you look good. And I want to hear your Capitol memory. So please join us and watch for the show, which is going to be aired online through the Capitol and the Whiting here very shortly. If there's a question, I'm willing to take it. And thank you, President Ray and past President George, for letting me speak a couple minutes here.
Oh, yeah. Thank you, Michael. Of course, I am keeping notes about your fine when we get back together.
Yes, we will. And Anne Marie and I will split the fine, I think.
Ah,
Okay, now we're ready for our guest, for our speaker. Ms. Erica Thrash-Saw. Flint Rotary welcomes you, and you are front and center.
All right, thank you very much. Our board chair, Louise McCarr, is going to kick us off. Can I share my screen?
Yes, you should be able to.
Okay. All right, I'm going to share my screen.
There it goes.
Can everybody see?
Yes.
Okay. All right. All right, Louise, can you kick us off?
Yes, and I hope you can hear me because can you hear me? My volume, I've turned it up all the way, but I don't know if it's low. But
It
Yeah.
is, we can hear.
is it low?
It is for me, but it's okay.
We can hear.
Oh, I tried a couple. Anyway, hello, everyone. I am Louise McCarra, president of the McFarland Board. And thank you to Lynetta for giving us this opportunity to speak with Rotary Club today. We want to share our vision not only for McFarland villages, but for older adults in the greater Flint area. Before I turn the presentation over to Erica Thrash-Saw, let me give you an overview of McFarland villages. As part of our 2018 strategic planning process, we updated our mission, vision, and values to reflect the work that we were doing to plan for the future. During that process, we recommitted our organization to working in the greater Flint area. We also committed to innovation and creating models that could be replicated in other communities. Here are some of the milestones of our history. 1926, a trust was established by Mary McFarland Whaley, which included $225,000 and her home property on East Kersley Street in the city of Flint. This trust was created for the purpose of providing and maintaining a home for, quote, old ladies. The trustees were authorized to receive into this home dependent and aged women. 1972, with the construction of the downtown section of I-475, a portion of McFarland Home had to be torn down. A new modern facility was built next door, and the old McFarland Home became Whaley Historical House Museum. 2003, McFarland Home built a $2.3 million expansion. The new wing added 8 suites, bringing the total number of apartments to 29. 2011, McFarland Charitable Corporation was presented with the opportunity to purchase the 2 Court Street Village apartment buildings on East Court Street. The apartments, built for low to middle income older adults, were struggling to keep up with their MISHDA mortgages and were in danger of going under. The board made the bold decision to purchase the properties, recognizing the great need for affordable senior housing in Flint, the proximity to McFarland Home, and their location at the gateway to Flint, just off the downtown exit of 475. 2011 to 2016, the McFarland Board did the necessary due diligence to learn about current innovative services available for older adults. We soon learned the challenges of ownership of one property serving 29 residents versus owning 3 properties serving 285 residents. Our strategic planning consultants, the leadership group, were very helpful with this challenge. First, the board conducted a number of focus groups and interviews with Flint leaders. We wanted to learn more about the needs of the senior community in Flint. We spoke with a number of senior organization leaders, David Game from Wellsprings Lutheran, Catherine Bowles from Valley Area Agency on Aging, and Roger Myers from Presbyterian Villages of Michigan, PVM. The board also toured a number of facilities offering innovative services for older adults. We visited PACE programs in Western Michigan, the Helm in Grosse Pointe, as well as a number of PVM villages. Additionally, the board recognized the need for an executive director. 2016, this was a year of great change for McFarland. With the goal of hiring an outstanding management company to carry out our vision, the board hired PVM. The board has had several opportunities to tour the campuses of PVM villages, most notably the Tomei Rivertown neighborhood in downtown Detroit. This demonstrated to us why they have such an excellent reputation, not only in the state of Michigan, but nationally. They are known for high quality, innovative senior housing plus, whether it's affordable or high-end housing. Next, we hired an executive director, Erica Thrash-Saul, to develop new ideas and strategic partnerships to benefit our residents. Erica, a Powers graduate originally from Flint, has been an energetic, knowledgeable leader. The board made it a requirement that she live in the community. This prompted Erica to move her family to the Fairfield Village neighborhood adjacent to Court Street Village. Additionally, we hired several exceptional new board members to our dedicated board to continue our mission. Erica will now present to you what's happening at McFarland Villages today.
Thank you, Louise. And before I tell you all about the wonderful work that McFarland is doing, I do want to talk about the types of senior housing and services, just so that everybody, we level set kind of the knowledge of what's offered. And so I want to start with independent living. Independent living, the prices can range anywhere from $500 a month to $3,000 a month. And they're typically private pay, or you can utilize a Section 8 voucher if you qualify. And the features of independent living range anywhere from, just an individual apartment. It might be 1 or 2 bedrooms with a kitchen and 1 or 2 bathrooms. Some communities, offer things like meal service, housekeeping, laundry, transportation, and activities. Some have social workers on site, home care companies on site, and they provide things like physical therapy or occupational therapy, checking vitals, or private duty nursing. Many communities have full service salons, and they are not awfully regulated. They're regulated if they receive funding from HUD or they're a tax credit building, but many are independently owned and not regulated at all. And for assisted living, many people have heard the term AFC, or adult foster care. That is one licensing type if you're serving 21 residents or less. If you're serving more than 21, you can be licensed as home for the aged. And assisted living prices range, the average for a private suite is around $4,000 a month. You can find some places where the base price is around $3,000 and you might have a shared suite. But if you need memory care services for dementia, that price jumps to around $6,000 a month. And assisted living is all private pay. Some features of assisted living include a 24-hour staff. There's often an LPN on staff. There are meals and housekeeping services, laundry, and help with activities of daily living like bathing, getting dressed, incontinence care, medication, and health management. There are often lots of activities at assisted living. There's transportation, and they are regulated by the state. And now we move on to skilled nursing. Skilled nursing on average is about $10,000 per month. There are some skilled nursings that do have Medicaid beds, which is helpful if you qualify. Skilled nursings, they have all of the services of assisted living with less of a focus on the activities and more focus on medical care. They are staffed typically with registered nurses, and then they'll have a medical director who's a physician. They are heavily regulated by the Centers for Medicaid and Medicare Services, as well as the state. And they often have physical therapy and occupational therapy on site. And then lastly, we have home and community-based services, which is really probably the biggest or the most growing sector in senior services. And they are just that. They are services that are offered either in your home or maybe at a day center. And home is defined as, it could be in an independent living setting. It could be, in a regular apartment or a single family home. And those services can include a home care company, which there are quite a few. It's a growing area, as well as Valley Area Agency on Aging, or PACE, which is Program of All-Inclusive Care for the Elderly. So all of that, those are the types of services and senior housing models that exist. So next, I'm really excited to talk about McFarland. McFarland is really a gem in the city of Flint. It's the oldest nonprofit senior living provider in the city of Flint. Many of you have passed by our Court Street location. It sits between Lapeer Road and Crapo, just east of 475 on Court Street. If you've seen the red roof building, it's a white building, and then there's a tan one right next door. That is the Court Street Village Apartments. And we offer so much on that campus. We have 254 units of affordable senior independent housing. We have wellness activities. We have a community health worker. We offer transportation. Our residents on that campus, they range in age from 55 to 99 years old. In addition to the services I mentioned, we also offer 2 meals per week. And post-COVID, we will be a congregate meal site 5 days per week. We have a home care company on site called Evergreen. And I would say the most wonderful part of our organization is our staff. We have staff that our staff know every single resident on the campus and have a relationship. They're very engaged. We have a wellness coordinator that provides phenomenal activities that really tap into our residents' mind, body, and spirit. The photo that you see, I love this photo because it really demonstrates our level of engagement with the residents. Our residents were doing a bucket list activity. And one of the things that was uncovered is that many of our residents had never been to a beach and they had never been to any of our Great Lakes. And so this is a photo of some of the Court Street residents. They did a lighthouse tour and they visited Lake Michigan. And the other big thing that McFarland, kind of the flagship organization of McFarland, is the McFarland Home, which, if you know where the Whaley Historic House is, where McFarland started, McFarland Home is right next door. On that campus, we serve 29 women and we subsidize the care. If you remember me saying that the average cost of assisted living is $4,000, McFarland is roughly half that amount. And so we're able to provide high quality, all-inclusive care for people who otherwise would not be able to afford it. Our average age for residents at McFarland Home, the range is between 65 and 98 years old. And, we really serve, a gamut of residents, some people who need very minimal support to people who have dementia or other significant health needs. McFarland and Court Street, we are heavily focused on our staff. We're very focused on staff development. We recognize that staff, they bring their whole selves to work. And we want them to be the absolute best that they can be so that they can deliver the highest quality of care to residents. We offer ongoing staff development and staff appreciation all year long. Next, you see on the screen, the Hamilton McFarland Senior Health Center for Primary Care. This is an exciting new project that we've been working on for about 3 years now, and the health center will be opening at the end of this month. And we are opening this in partnership with the Hamilton Community Health Network, which is a federally qualified health center. We will have the only partnership between an affordable housing and federally qualified health center in the country right on the Court Street campus. It will be inside of our Court Street East building. And we are going to be delivering high quality healthcare, primary care to help residents prevent as well as manage disease. This health center will not only be open to the people who live on the McFarland Court Street campus or McFarland Home, it'll be open to any older adult that's age 55 or older in the Flint community. And our goal is to create health equity for older adults who are underserved. the high-end senior living communities, they have full health centers with an array of services. So we want to make sure that we have comparable services in the affordable housing communities. It's really important with the high cost of assisted living and skilled nursing. It's imperative for older adults who don't have resources to be able to stay as healthy as they can so that they can prevent or manage disease and age in place. And the health center will provide that. We're not only will they have the high quality medical care, but they're going to have wraparound services through our community health worker. Anybody who comes to the health center will be able to take part in the congregate meal. They'll be able to take part in any of the activities that are offered to the residents on our campus. So it will really be able to help round out some of those additional needs that older adults have. I wanted to put this slide up here. This is Claudia Arnold, or this was Claudia Arnold. She was really the catalyst for this health center. Claudia, she was a former resident assistant at a nursing home and teacher's aide in a school for children with special needs. And she died too soon because she didn't have the resources she needed to get the care in time. And so Claudia was a resident at Court Street for many, many years. And I met Claudia one summer, I think it was my first summer actually working for McFarland. She was having to have surgery. She had already had one leg amputated because of complications from diabetes, and she had to have the second leg amputated. And that summer, we had one unit open in McFarland, which we don't have very often. As you can imagine, the need is great. And so I called her sons. I said, listen, I really want you to go look at that. Your mom has had her second leg amputated. It may be hard for her to care. We'll be able to help, subsidize this. And I don't want her not to be able to get a spot. So her son went and looked at it, thought this would be ideal. And then I got a call from Miss Claudia blessing me out about getting in her business and, causing her to have to move from her home. But she soon learned that, moving to McFarland home was going to provide the type of care that she needed. And so I can recall one night, I was working late at McFarland and talking with Miss Claudia, and she said, I really would be in much better health had I moved here a long time ago. By this time, her kidneys were completely failing. Her heart was failing. She was just really struggling, even though, she was, in better care, starting to do better, but things were too far gone. And she just said, if I could have moved a lot sooner, or I could have had better medical care, I knew more about managing my disease, I definitely wouldn't have lost my other leg and I'd have still been able to live independent. And so, that really got us thinking, how can we help older adults like Miss Claudia be able to stay independent and have a quality of life and preserve their health? So that was really the catalyst for the health center. And so McFarland does far more than just provide housing. I mean, we really strive to be an asset in Flint and a leader in aging services. And so we have quite a few partnerships with universities. With the University of Michigan, we have several interns. We've had up to 12 interns per semester, both clinical, public health, and healthcare administration, really so that anyone who is training to be in the medical field and wants to work with older adults really gets to see how older adults, they get to build relationships with them and work with them in their homes. And so it's just going to make those students better clinicians or better administrators as they get out in the world. And that's some work that we're very, very proud of. And we do quite a bit of grant-funded research projects with both faculties and students at University of Michigan. And one of the things we're very excited about this fall in 2021, we will be kicking off an intergenerational housing program with students from the graduate program of the physical therapy and the doctoral occupational therapy program at U of M Flint. They will actually we'll have 4 students living at Court Street Village, and they, in return for living on our campus for free, they will do 20 hours of service per month with our residents. Another thing that I really want to highlight, that McFarland is the founder of Leading Age's Summer Enrichment Program to create diversity and executive leadership in the field of aging. We will host our first cohort of students throughout the country in June. And I may connect with many of you because we'll be hosting 4 of those interns in the state in Michigan, and one will be housed in Flint at the Court Street Village. Well, as McFarland, as you know, as Louise mentioned, McFarland is almost 100 years old, but we are still growing. We've got some phenomenal future plans. And for 2022, we are planning a substantial renovation of 230 units of affordable senior housing, and we're going to convert 24 units into an affordable assisted living. You know, I keep going back to that $4,000 a month cost that most people cannot afford. And so there is a model that we will be using, as Louise mentioned, the Tomei Rivertown. We'll be utilizing that model, and we'll have 24 units right inside of our Court Street West building. We also are planning to renovate McFarland Home. Our last renovation was in 2003. You know, a lot has changed in terms of the way in which we deliver services and care. We provide a lot more medical care than we ever have before, and we have a lot more residents with dementia, so we want our space to reflect that. And then on our Court Street campus on the south, right in front of 6th Street, if you know where that is in the city of Flint, we plan to develop 24 independent living cottages. And the McFarland board had the foresight years ago to purchase property around our communities. And so in the future, even beyond 2022, we plan on developing our vacant land and building more senior housing just to make sure that there is enough affordable housing in the city of Flint. If you're asking or wondering, you know, how can you engage with us? We do have needs. One is volunteers. You know, we need volunteers to do everything from sit at our front desk and welcome people and answer the phones to actually running activities and leading activities. We need funding to support benevolence and wellness activities. As I mentioned, although we are subsidized, we still have residents who cannot afford our assisted living costs. I just got a benevolence application yesterday. We have a resident who's been with us about 4 years. She was a nurse at McLaren, and her savings has run out. She's 96 years old, and all of her savings has run out. And so all she has now is a small pension and Social Security, which isn't enough to pay the cost for her to live at McFarland. So we'll be able, because we do have some benevolence funding, to continue supporting her throughout her life. And so we always need support and fundraising and funding to support benevolence. Another thing is our wellness initiatives. You know, there was a time when we didn't have as many people going to wellness activities because we had fees attached to them, small fees. And once we surveyed the residents, many said, I just don't have the money to go. And so at that moment, we made a decision, all activities will be free, because it's so important for seniors to stay engaged and not have to combat loneliness and social isolation. And so in order to keep those activities fun and robust and meaningful, it does take quite a bit of funding. Next is advocacy. You know, there's so much advocacy needed on behalf of older adults. Everything from making sure that, you know, there are Social Security increases every year, and, you know, there are increased coverage of Medicaid and Medicare, you know, to making sure that older adults are just thought about and included as people are planning activities. And then next is in-kind donations. We have quite a few residents at both our independent living and assisted living who are incontinent, and the cost of those briefs and depends are just quite expensive. And so things like that, toiletries, even services coming and doing things like, you know, playing piano or providing entertainment is so needed. And then lastly, our residents love serving their community. And so if you have any volunteer opportunities that you think would be wonderful for older adults, our residents would love to do it. Currently, pre-COVID, they volunteered once a week at the community closet. They volunteered at a daycare center that's across the street from McFarland Home, and at the Franklin Street Mission, where they served food and rolled silverware each week. And so I'm going to pause here for questions.
Any questions?
Just one question. This is Marie. Are you doing anything with the local senior center?
We do. Our residents, if you see the picture with the man showing his muscle, that is a picture of one of our residents at Brennan Center. Our residents pre-COVID, they went to Brennan Center twice a week to exercise and to do activities. So we do have a strong relationship.
Good. That's good to hear. Okay.
I don't have so much as a question, but I'd just like to comment that as Erica mentioned, there's been a relationship with U of M Flint, and I can attest to the great value that you and your organization has brought, particularly to the College of Health Sciences and to Dean Donna Fry. And I wanted to just announce to everyone that Erica is going to be on a panel and involved in a symposium that U of M Flint, the Center on Aging, is hosting on January 14th. And I just attached the information in the chat section on this, on our meeting here. So if anyone is interested in attending and participating in that, please do so. There's a number of people that are going to be involved, and it's really a, you know, the more input, even if you're not in the senior arena, you know, you have parents, you have loved ones, people that you know, you can certainly speak on behalf of or get more information. So just wanted to say that, and thank you so much, Erica, for the presentation's fabulous.
Thank you.
Erica, I have a question.
Ellen, did you put that information? Where did you put it?
It's in the chat. I attached a PDF in the chat,
Okay.
but I can also, you know, if you want, I can email it directly to you if you're interested. Just
Ellen, if you could, yeah, if you could to me, I'm on the board at the Flushing Senior Center, and that would be something that I think some of our board members would like to attend to, as well as our director.
Okay, will do.
Okay, thanks.
Erica, I have a question. I know your numbers are just going to continue to increase. And I know there's a concern about this COVID-19 virus. What kind of precautions are you taking to keep the residents healthy?
So I'm so happy that you asked. I will tell you, we have been extraordinarily fortunate. At McFarland Home, well, let me back up. We really started early. You know, I have a sister-in-law who lived in Italy, and Italy was really hard hit, and she started talking about, you know, COVID and the things that it needed in February. And so the end of February, I scheduled a meeting with our staff, and I said, you know, you guys, these type of viruses travel. We've got to get prepared today. So we started ordering PPE and planning for COVID the first week in March, long before anything shut down, long before people started to plan. And we were very aggressive. And I think that really helped us, because as of today, we have not had one case of COVID at our assisted living. And our residents are slated to be immunized on Tuesday. So I am, you know, every week is a prayer that, you know, everybody is negative. Out of our 270 residents who live on our Court Street campus, to date, we have had 6 that have had COVID, but we've had no fatalities. And so but as an organization, we took very aggressive measures. You know, the staff very early on had to wear a mask. Even before it was mandated or suggested, we started wearing a mask. And then once it was mandated to wear a mask, our staff wore the N95 mask. Another decision we made early on is that, you know, staff would change their clothes and wash their hands. We had a whole procedure when they got there. And so we launder all of our scrubs for our staff when they get in the building. You know, for a long time, you know, our residents were stuck in their rooms for a long time. And so we had to be very creative around doing one-on-one activities and making sure people got enough exercise and outside and, you know, things like that. And really robust cleaning. So every hour we have a law where all of our commonly touched spaces have to be sanitized. And so that's something that we have been just religious about since the outset of COVID. And these are things that I do believe, you know, however, you know, COVID's a pretty sneaky virus, but I do believe just our hyper attention and hyper awareness to it all has kept us safe. And for any of you who are on Facebook, please visit our Facebook page. It'll give you a sense of our culture. You will see we created a hugging booth, and that those pictures went viral. We were actually on Channel 5 News a few weeks ago, and we've had over 7 million people view our hugging booth, where
Oh,
residents were able to, through very safe measures, actually touch their loved ones.
fantastic. That's great. Just great. Are there any more questions? All right, can you give me that screen back? I just got a message here. Next slide. Next. There we go. Actually, Erica and Louise, in appreciation for the time and preparation that you donated for your very educational presentation, the Rotary Club of Flint will make a donation in your name to the Rotary International Foundation for the eradication of polio. We thank you both for joining us for this excellent presentation. We sincerely appreciate it at Flint Rotary. Thank you much.
Thank you so much.
I want to thank Ellen for her very inspirational message and our note taker, Rita Stanley. Flint Rotary thanks each and every one of you for joining us today. I hope you enjoyed our program as much as we enjoyed welcoming you as members and guests. Coming up next week, Kearsley Street Week. Be safe, stay warm, and look to open opportunities in order to provide service above self. Enjoy the weekend, and we are adjourned. All right, good job.
Bye.
Okay, we got everything.
Thank you, Ray. I appreciate you giving me a couple minutes there. Thank you. And thank you, George. Appreciate
Oh, yeah.
it.
Glad to do it.
Now be sure you come by and tell me a capital memory. It'll be a lot of fun.
Okay.
I'll make you look really good. Bye-bye.
All right, bye-bye. Okay, well, welcome back.
Yeah, I guess that's it.
Yeah.
All right. Well, have a good
Wow.
week. We made it through another one.
Right. Kearsley Street Week. What is that all about?
You remember when it's like the stock prediction thing where we have people who come in and
Oh, yeah.
they pick stocks last year and then they come back and they see how they did with them. And then Dave Smith does his dart man thing where he throws a
Right.
dart.
Right. Okay. Okay.
So that's usually a pretty fun one. So I think we'll probably get pretty good turnout for that.
Okay. Sounds good.
Yeah.
All righty. Well, you have a great weekend.
All right, Ray, you too. Thanks.
All righty. I'll see you soon.